In this video, I want to describe and demonstrate how to perform palpation for soft tissue structures around the foot and ankle. So I'm going to start off with the anterior structures and we'll kind of move in a circle around. So the anterior part of the ankle, the two main soft tissue structures that I'm interested in palpating are his tibialis anterior muscle belly and tendon. If you're trying to locate where that tibia anterior tendon is, you can have him actively dorsiflex. Good, and you can see it pop out. So it's the most prominent tendon here on the anterior ankle. I can kind of punch it through there. It's pretty large on most individuals. And then the tibialis anterior, you can find this tibial shaft and come just lateral to that. You're going to be on the tibialis anterior. You can pull that muscle all the way down and the tendon down to where it's going to insert on that medial cuneiform and first metatarsal. The other main superficial kind of muscle group and tendon we can palpate for on the anterior ankle is going to be if he dorsiflexes and pulls a little bit into eversion. I can see this lateral tendon and group of tendons pop out, and that's going to be the extensor, digitorum, tendon and muscle tendons as they attach to the digits, and then muscle as it travels within this anterior compartment. So it's going to be just a little bit lateral to that tibialis anterior. You can sink in and you can kind of palpate through here. It's hard to differentiate between extensor digitorum and then your extensor hallucis, but that common extensor digitorum tendon is going to be here. As I have him turn, you can move to the lateral ankle structures. The lateral compartment of the lower leg is going to contain the peroneal muscles, also known as fibularis muscles. So it makes sense. It's right next to this fibular bone, and so these muscles are going to be in the lateral compartment. So you're going to have the fibularis longus, which is going to attach to the fibular head. So you can palpate from that fibular head all the way down, and then the tendon of that fibularis longus is going to start right about here, and you can follow the tendon right around that lateral malleolus. And sorry, it's not going to come here, it's going to come down and around. The longus is going to come down and around. The brevis muscle is going to start a little bit more distally through here, and its tendon is going to extend down and attach to the base of this. Was one of our bony landmarks, so the base of the fifth metatarsal. Fibularis brevis is going to attach right to the bottom, whereas the fibularis tertius is going to come across and attach to the top, and that's going to explain their different actions, either a dorsiflexion for fibularis tertius or a plantar flexion moment for fibularis longus and brevis. The other structures we're interested in palpating on the lateral ankle are the ligaments, and for lateral ankle ligaments we have ATFL, CFL, and PTFL. So anterior talofibular, calcaneal fibular, and then posterior PTFL, posterior talofibular. So I think of these as kind of the orientation of a cross. So I think of ATFL running here, CFL running here, and PTFL running here. And so I can come off of that lateral malleolus and palpate through and kind of rub through almost oblique to the fibers to feel where those ligaments are. So ATFL, CFL, and PTFL. If he turns again, we can kind of look at the posterior structures and then the medial structures. So we're going to want to palpate through the Achilles tendon, which is going to be the common tendon for the triceps surin muscles. So gastrocnemius, medial and lateral heads, and then the soleus deep to that are going to end, and also the plantaris actually are going to end in this Achilles tendon, and we can follow that tendon down all the way to where it attaches on the calcaneus. We can also palpate just anterior to the tendon and kind of pinch in and around and feel this fat pad in here, described as Keeger's fat pad is the eponym, and then a little bit lower in that area will be the retrocalcaneal bursa. So if somebody has what you would think of as bursitis type symptoms, that's going to be something that you might want to palpate to differentially diagnose. Another fat pad or soft tissue structure in this area is going to be the calcaneal fat pad right over the calcaneus. So pretty robust group of tissue along that heel. You're going to palpate along there. And then as we move into the medial ankle, we're going to want to palpate the structures that pass through the tarsal tunnel. So medially, this is going to be the tarsal tunnel, canal, or way that structures pass into the foot. And what I try to remember, this is the acronym I use, coming from anterior to posterior. I use the same Tom, Dick, and very nervous Harry. So T is going to be my tibialis posterior. That's going to be closest to my medial malleolus. D is going to be my flexor digitorum muscle that wraps around. A, B, N are going to be my tibial artery, vein, and nerve. And then H is going to be my flexor hallucis lumbar. So it's going to come down through here to the great toe. So those are my tibial tarsal tunnel structures. Next, I want to think about palpating the ligaments on the medial ankle. So these are going to be described as a group as the deltoid ligaments. And again, for simplicity's sake, I try to visualize these. There are 4 on the medial ankle that we're going to discuss. I try to visualize 3 of these as more of a cross orientation. So here, here, and here. Since we're on the medial ankle, these are going to be the anterior talofibular ligament, posterior talofibular ligament, and fibula is on the outside, anterior tibiotalar, posterior tibiotalar, and then calcaneotalar here. And then we're also going to locate the 4th is going to be the calcaneonavicular ligament. Talonavicular ligament, from talus to navicular. Sorry about that. So anyway, we're going to locate the anterior ligament here from the talus to the tibia. So talotalar here. The talonavicular here, and we can feel that navicular tubercle. And then the calcaneo tibial here, running from tibia to calcaneus, and then the posterior tibiotalar ligament there. We can also palpate through the plantar fascia, through the arch, and as it emanates off of that medial calcaneal tubercle, that will be an important attachment point as well.